Now, on Emeritus Newsbrief, I'm Lynn Houston. Senate Democrats are successful getting more support for their health insurance reform bill. During a news conference held by Senate Majority Leader Harry Reid, the American Medical Association gave their blessing to the Democrats' plan.
If you look at the morning polls today, there are some polls that show, just as a result of our passing this, the support of this bill is up about 10% just overnight. The American people, once they have the information, will be totally supportive of this bill.
The endorsement came after an early Monday morning vote where all 58 Democrats and 2 independents made the 60 votes needed to avoid a Republican delay on the bill. The final Senate vote on the health insurance reform bill could come Christmas Eve.
By standing up to the special interests who've prevented reform for decades and who are furiously lobbying against it now, the Senate has moved us closer to reform that makes a tremendous difference for families, for seniors, for businesses, and for the country as a whole. For those who have insurance, reform will mean greater security and stability. No longer will people with pre-existing conditions be excluded from coverage. No longer will people who are seriously ill be dropped from coverage. And no longer will families be allowed to go broke because they're forced to pay exorbitant out-of-pocket expenses. Many people recall the enormous fights around the Patient's Bill of Rights that never got done. Well, you know what? The Patient's Bill of Rights is embedded in this health care bill, and it makes sure that all Americans who have insurance right now are getting a fair deal from their insurance companies. Small businesses and those who don't get insurance through their employer will finally be able to get insurance at a price that they can afford with tax credits to help. And Medicare will be stronger and its solvency extended by nearly a decade. Seniors will get more assistance with prescription drug costs than they're getting right now. And finally, these reforms will help the inexorable and unsustainable rise in health care costs that are overwhelming families, businesses, and the federal budget. The Congressional Budget Office now reports that this bill will reduce our deficit by $132 billion over the first decade and by as much as $1.3 trillion in the decade after that.
You can see the president's entire media briefing and the news conference held by Senate Democrats after this news brief on the Emeritus News channel at livestream.com. The Obama administration announcing new regulations on the airlines. Airlines have to let passengers deplane from flights stuck on the tarmac for 3 hours, with exceptions allowed only for safety or security reasons, or if air traffic controllers advise the pilot in command that returning to the terminal would disrupt airport operations. Airlines have to provide adequate food and drinking water within 2 hours of the beginning of the delay. And airlines must maintain operable lavatories and, if necessary, provide medical attention. The new rules were ordered due to increasing passenger complaints, including the incident August 8th, when passengers were kept on a crowded airplane for more than 6 hours overnight in Rochester, Minnesota. Airline and terminal managers refused to allow them into the terminal because it was closed. Ford Motor Company offering another round of buyouts for all of its 41,000 factory workers. The company eliminated 9,000 workers this year through buyouts, attrition, and layoffs, but still has a labor surplus. The buyout includes, for those with at least a year of service, $50,000 cash, the choice of a $25,000 voucher to buy a vehicle, or $20,000 more in cash. The deal also includes basic health coverage for 6 months. Retirement-eligible workers can take a buyout, but must wait up to 18 months before retiring. The retirement package includes $40,000 for skilled trade workers and $20,000 for non-skilled employees. To be eligible, workers have to have either 30 or more years of service, be age 55 and older with 10 or more years of service, or they can be 65 years of age with at least 1 year of service. CDC officials saying that more than 100 million injectable doses of swine flu H1N1 vaccines are now available and that they will soon be available to some drugstores and physician offices. The outbreak continues to decline, but officials warn it could make a comeback, and the best defense is inoculation. 2 major company pension failures to report. The Pension Benefit Guarantee Corporation says it has taken over pension plans at Visteon Corporation, covering more than 21,000 workers, and the the pension plans at Fairchild Corporation, covering more than 6,600 workers. The PBGC says the Vistion pension failure will cost more than $500 million to protect the workers, and the Fairchild plans will cost about $55 million. Both companies are in the middle of bankruptcy and were not able to pay their pensions. Allstate Insurance paying $4.5 million to settle an age discrimination lawsuit. The Equal Employment Opportunity Commission filed the suit on behalf of 90 former agents who were converted to private contractors without a company severance. The change had a disproportionate impact on employees over the age of 40 because more than 90% of the agents were 40 years of age or older. Allstate has denied violating any laws. The latest on the biggest issues and public policy at emeritusnews.com. And live 24 hours a day, 7 days a week on the Emeritus News channel at livestream.com. That's an Emeritus News Brief. I'm Lynn Houston.